instead of sitting on a cushion trying to meditate when you have a lot of worries, a lot of things going on in your lives, a lot of unanswered questions. It can be frustrating for somebody that is not used to doing it already. So as an introduction to mindfulness, the creative process is absolutely, playful. They don't know they're doing it, and they find themselves benefiting from it. Said, oh, wow, I didn't know I could do this. See, this is I love this little guy. So, yeah, there is a lot of resistance, doesn't it? And this is a very famous quote, the Serenity Prayer, that I'm sure it's in many, many offices to just remind us, of the wisdom that we have to use. There are lots of articles. This one is a very good one by Dr. Christensen in Minnesota Medicine, and these are all beautiful outcomes of using art in a clinical setting. Examples from Mayo Clinic, and even though I don't like to talk about this, but it's been proven that it saves money too in critical either in a medical setting. So it's really something fun. Okay, we're not having fun yet, right? Okay. So I love this quote. This is one of my favorite quotes. It's actually in one of those books. Much of the suffering in the world comes from the delusion that we are separate from one another, and that's when the empathy, among patients, when they come and do a workshop together, or when they are, in the waiting room, or in the chemo room, or when they are with you. Definitely, this is something that, as we make that connection meaningful through maybe an activity, it's definitely what really makes a difference. So it is, like I was saying at the beginning, it is a win-win proposition, and I really recommend one of the TED Talks. TED Talks. They're very popular right now. They're only 20 minutes, and they just bring the best of each field. And Joan Halifax, so she works with end-of-life care and prisoners on death row. And she talks about compassion and empathy, and she really emphasized the benefit for both caregivers and patients. It's really a beautiful talk that I recommend. So there are two assumptions in expressive arts therapy as we make the proposal to use it in healthcare. And one is that our psyche needs to express itself to be healthy or to bring back health. So this is definitely a very important factor to keep in mind. And also, we have a wonderful scientist here in San Diego at UCSD, is the director of the Brain Neuroscience Research Center, Ramachandran. He calls the mirror neurons that are in the frontal cortex, they are responsible for creating this empathy. He calls them Gandhi neurons. Of course, he's Indian, but it's perfectly fitting. And by the way, the mirror neurons were first discovered in Italy in the mid-90s by scientists that were actually scanning the brain of people and chimpanzees, and they saw that not only when somebody would perform an action, but also somebody watching the action being performed or just imagining, the mirror neurons would fire and make connections at exactly the same way. So that's why art is so important as a symbol of real life, because even if you watch a movie, you find yourself laughing or in tears, or you participate, and that participation in science is definitely the development of empathy. So, and in fact, this brings to the second assumptions that our brain loves stories. In telling stories, watching stories, hearing stories, and making things up. And when we do an expressive arts therapy process, making things up is about making something meaningful for ourselves. So again, photo painting it's one of our of the format that we use. We give patients a camera if they don't have their own, and they take pictures in the moment, whatever attracts their attention, or whatever fit the feeling and the emotion or what they're going through at the moment, and then we bring them back and we make mixed media paintings with those pictures. This is a wonderful example. Somebody came in with a very strong discomfort in her stomach, and she didn't know what it was. She was doing testing, but nothing was turning up. And she started painting in circle just intuitively, just out of frustration. She didn't want to do anything else. And after an hour of painting in circle, she really called my attention. She said, my stomach feels so much better. It's amazing that whatever pain was there, it was almost completely gone just by channeling that frustration into the painting. So again, you build a relationship with your patients, and I don't have to tell you this, better than I do, that's really what make the patient comply better with whatever requests you have for them, behavior and choices, making better choices. So this is definitely a something that whenever you work with them, you have to keep in mind. And the processes have to be very simple. You have to prepare everything for them so that they don't have to worry about, how, but they just have to go and play. And again, simple instruction, not too demanding, and just let them play. That's definitely the being fully present and focused that helps. It's very self-empowering also for the patients to not to be told what whatever they're doing means. There is a tendency in all of us pretty much to say, oh, you did this, and it might mean that or that. But if you just prompt them and ask questions and let them, how do you feel now that you've done this? What do you think it is? This patient picked an image of this melting snowman, and immediately I felt a sadness. But I didn't want to, convey what I was feeling, because of course that was mine. It was, oops, it was mine. And then she put that sun setting or sun rising next to it. And so it took a few, some time. I was going around looking at everybody's work, and then I kept coming back to her, asking her, kind of prompting her to dialogue with this image. And she came up with her own understanding of shedding, melting the old life and rebirthing into a new life. This was the life that she wasn't expecting, but that's the life that she had. So she came up with her own explanation for it. I'm sure everybody can see their own, but that was really, making her feel like she was in a little bit of control compared to not being in control. And I just list a lot of research, and you have in your packet, there is plenty of articles and research from, very major universities. And this is, adapting to, of course, playing with the kids and teenagers and the things that they say, we think that children cannot stay still or can't meditate or can't be focused, but if you give them something that they can get into, they really love it. So all the positive outcomes from using expressive arts, and in conclusion, I just want to really stress that a collaboration with all of us working with patients, I think we can come up with really meaningful and doable, feasible, practical things that we can do bedside or in nice bigger rooms and facilities.